Hi, I'm Jim Jordan, and you just signed up for an appointment with me. And before you come in to see me, I'd like to give you a little of my background and what live blood cell analysis is and what you can expect in an appointment. So I got into the field of natural healing in about 1996 after I'd struggled with my health for about 6 years in the 80s. And I got my health better through natural healing. And after a few more years of working in the legal profession, which was my previous career as a lawyer, I decided to make a change into the field of nutrition. So I came across this amazing technology called live blood cell analysis. And that's what you're going to be coming in to see me for. Live blood cell analysis is a test that I do for my clients that's very educational. It teaches them the underlying causes of their health problems. Now, back in Chicago, I had worked in medical clinics doing this test for holistic doctors, and it was used as part of their diagnostic workup and the educational program for the patients. Here we're going to do this, we're going to use the live blood cell analysis basically just to teach you the underlying causes of your health problems. So what is it you can see in a live blood cell test that can pertain to your health? Basically, we can see whether there are nutrient deficiencies, specific nutrient deficiencies, and we can see if there's certain amounts of toxins in your blood. So these are generally the two major things we look for. That can show up as inflammation in the blood, waste particles or toxins you visually see, cells that are not the right size or shape, or they're deformed. But basically you're going to see whether there's your toxic load and nutrient deficiencies. The third thing you can see is the level of pathogen overgrowth that you may have in your body. And some of that will show up in the blood too. So that's generally what you're going to find in the live blood cell test. And of course, I'll be making recommendations to you to improve all those observations, any of those that we have for your blood. The way you prepare for your appointment with me, there's several things I'd like you to do. First of all, you should fast from all food for at least 3 hours before our appointment. So if our appointment is at noon, from 9 o'clock on, you should have no solid food. You can have fluids like water or tea if you'd like, though. Second, you should complete the intake forms that I've emailed or mailed to you. There's 2, possibly 3 forms I'll be sending to you, depending on the information I want to get from you. You should complete those and get them back to me before the appointment. So what you'll be experiencing in an appointment with me is when you come into my office, I would have reviewed in advance your intake forms. If you didn't send them to me in advance, I'll go over them with you at the beginning of the appointment. And then I'm going to get 2 samples of blood from you. This is just a finger prick. It's painless. It's very simple. I'm going to put that blood sample under my microscope here. We're going to be looking at the blood. I'll be looking at the blood first through these eyepieces, and then I'll be projecting the image with this camera onto my computer screen. If it's in my home office on this computer, if I'm traveling, it'll be my laptop. Then what I'm going to do is basically go over the most important observations I see in your blood and explain to you what they mean. If you've watched this whole video, you'll know most of this in advance. You'll know what the blood pictures mean, because later in this video I'm going to explain to you what the blood pictures mean. I'll explain to you again what it means. I'll make recommendations then. So I'll be looking at live blood and a second sample, which is called a dry blood sample, which will go over some examples of what that shows us about your health. I'll explain to you what both the samples mean, how they pertain to your health, and then I'll make recommendations for you. The recommendations, you should write them down. I'll write them down too. If you have questions about what I recommend, you can ask them at the end of the appointment, and that's it. It's very simple. We'll set up a recheck, which is anywhere from 2 to 6 weeks, depending on your condition and if you're local or if I'm traveling to see you. And sometimes those rechecks most of the time they're in person. Sometimes we do follow-up phone consultations if you have questions. There may be some additional tests that I recommend for you. If I feel we need to check for heavy metals or parasites or something else to get some verification of a blood observation, I'll make recommendations for that. But you'll leave the appointment with a set of dietary recommendations, probable lifestyle and supplement recommendations as well, with a plan and a scheduled appointment to see me next. I'd like to talk to you now about what I see as the underlying causes of all health problems, illnesses, diseases, suboptimal health conditions, all of this. We'll be looking at your blood in the context of your whole history, the things you've been exposed to, your diet, the stresses you've had, and I want to give you a framework of how we're going to look at your blood samples in. So the way I see it is there's 4 primary causes of all health problems. Number 1 is toxins. Toxins can come in the form of chemicals, heavy metals, radiation. Those are the 3 basic categories of toxins. They can all show up in the blood too, at least the effects you can see of all of that in the blood. So we're going to document in your blood the overall load, maybe through some other testing and some questionnaires. We'll get an idea of just how toxic you are and what you need to do about that to improve your health. Second would be nutrient deficiencies. Many nutrient deficiencies can show up in the live blood. Enzyme deficiencies, antioxidant deficiencies, B vitamin, iron deficiencies, and other deficiencies can't show up in the blood. We would need other tests for, or just through questionnaires we can get an assessment of that. Third would be emotions. Emotional trauma and stress is a primary cause of all health problems. Now, it could be that emotions is a percentage of your case. I don't deal directly with emotions in my practice. We can certainly talk about them, and I do have some ideas. I've worked through many of these things myself, and I have some techniques that can be helpful, but that's not the primary focus of what the work we'll be doing. It'll be mainly toxins, nutrient deficiencies, and emotions is third. The fourth cause will be chronic infections. Infections such as candida, yeast, fungal, parasite infections are seen also in the dry blood. Mycoplasma and viral infections, we can see signs of that in the live blood. And when you have chronic infections, it's going to suppress your immune system, make your body less capable of detoxifying, and be an impediment to recovery. So I look at your health, I look at it in the context of these 4 causes. Often they're interconnected, so one will influence the other. So nutrient deficiencies will make your immune system weaker, which makes you more susceptible to infections. Depression also makes your immune system weaker, of course, makes you more susceptible to infections. And toxins can impede your body's ability to absorb nutrients. So they're basically all interconnected. We'll look at the overall toxic load, nutrient deficiency condition, and level of infection, and layer that over your probable emotional stresses. And with that, we'll come up with a plan, a course of action to help you start moving towards better health. So the first live blood cell slide I want to look at is a picture of blood where the blood cells, or red blood cells, look basically pretty good. You can see here these red blood cells are about the same size, relatively separate. It's okay if they're just touching each other. And their job is to get oxygen and nutrients throughout the body. So when the cells are separate like this from each other, their surface area is exposed to the plasma to get nutrients and exchange CO2 for oxygen. So these red blood cells look basically pretty good. The only thing in this picture that would be noteworthy is these little bitty fuzzy balls here. You can see these, the red light shining on them. These fuzzy balls are called platelet aggregations. So what happens is if a person's blood is accumulating excess toxins or fats that are not digested, these will be activated and start to sponge up those toxins and excess fats. At this point, these platelets are small. They're not very big. Unless they're about 3 or 4 times the size of a red blood cell, they're not really a big issue at this point. So these are just sort of small and numerous and not a big problem. So that, let me see if there's anything else in this sample here. There's a few cells that are slightly, if you can tell here, there's a little bullseye inside of this one here. Slight little bullseye here. And when there is a little circle inside of the circle, that shows the cell is low in iron and is slightly anemic. So there's just a few of those, but basically this picture looks pretty good. This next picture we're looking at, we see the red blood cells are stacked up together. Instead of being separate like they were in the previous picture, They're stacked up. The cells they look like a roll of coins. So this is called rouleau. And many people are going to have this in their blood. At least a percentage of their blood will look like this. It could be anywhere from 10% to virtually close to 100% or 90%. What happens here is if there's undigested proteins or unprocessed fats or excess sugar that your body can't handle, those can all stick the blood cells together, so then the surface area is no longer able to get oxygen and nutrients, and your cells are slightly suffocating. Also, causes of this could be if there's a dehydration in the blood plasma, if you're not drinking enough water, if you're also low in minerals, some basic blood electrolytes, sodium, potassium, calcium, magnesium, have to be in an adequate ratio so these blood cells can stay separate from each other. So essentially, we're going to have poor digestion of protein, excess fat in the blood. You can see here there's little bitty particles in the background. See the red dot pointing these little particles? These particles floating around are undigested fats. So if this person had fasted for 3 hours like I requested, and they still have this much fat in their blood, that undigested fat is indicating a sluggish liver and gallbladder. Those fats can cause the cells to stick together for a while longer than they should, and then that has to be corrected. The other things that are in this blood sample are you have some crystals here, bigger crystals. These are waste particles or toxins. Toxins like chemicals or heavy metals, environmental toxins. Medication sometimes shows up like this, pharmaceutical drugs. And by it showing up in the blood, it indicates the liver is not able to clear the blood completely of this waste. So the overall recommendation on a picture like this is to help support digestion, help support fat digestion especially, and to help the liver work better, to clear out some of these toxins. So we would be looking for causes, exposures of toxins that this person has. Obviously, this is a still picture. This is not, these pictures are captured, so this captures a moment in the bloodstream. But this definitely would work on the person's liver function and digestion, and possibly hydration. So here, we've got a large piece of dead fungus in this person's blood. Fungus that came in probably from the intestines. And of course, fungus feeds on sugar and toxins. So this person has a little bit of fungal and or candida overgrowth in their intestines. And then also we have this large thing here, which is some waste that came in from the intestines along with the dead fungus. So this is an indication of what's called leaky gut syndrome. So this is actually a protoplast, which is sort of some waste or feces actually from the bowels that leaked into the blood. Now we have 1, 2, 3 white blood cells attacking this to try to clear this up. And there's another white blood cell here. And a lot of sticky blood around here. Another protoplast right here. So basically leaky gut. So what I would recommend for this person, number one, is starve the fungus and candida out. So not feeding it with sugar, yeasty foods, gluten, alcohol, cheese, anything that feeds fungal candida conditions. And probably be taking if this is a significant condition, a natural anti-candida, antifungal herbal program. Could be a variety of formulas. And then for the leaky gut, we have to take some good quality probiotics to heal the leaky gut. And there's a few other suggestions I'll make with diet and supplements for healing and repairing the intestines. And the rest of this blood picture is kind of sticky blood, probably poor digestion in general. This person has a large, fungus condition and leaky gut, so digestion could be impaired too. Here we have an interesting picture of blood. There's a white blood cell. There's some red blood cells here. And you can see here little bitty balls like this with strings going around them. These little balls are called mycoplasma. Mycoplasma is a type of bacteria that is in the blood and seen more and more these days. What you need to do is stop the foods that are fueling this growth, which are usually sugar, alcohol, the same things that feed candida and fungus. Think of this as like a blood-borne candida condition. And there's herbs that you can take that would naturally break down these cell walls and help your body flush this out. Some liver support would be really good for this type of case, and should be able to clear it up within a month or two, at least improve it substantially. Here we have a picture. We have some sort of faint red blood cells in the background, but this big chunk of glass-looking thing in the blood. It's unusual in that it's very large, but this is commonly seen in the blood. This is plaque. This is what builds up in your blood vessels that can lead to cardiovascular disease. So when I see this, there's usually a sign of a lot of free radical damage or toxins that are damaging the fats in the blood. Poor antioxidant levels to protect the fats from being damaged. Possibly the person is eating fried foods a lot or has some exposure to some high temperature cooking of foods where the fats are being damaged initially as they're eating them. But this can be cleared up. This is commonly seen. If we see this in a significant amount in the blood, there's a really wonderful cardiovascular clearing repair program that I can recommend and put you on that would clean this up. And some common things that can be used to fix this would be lecithin would be one thing, vitamin E, reducing fried foods, reducing the amount of toxins that you're exposed to. And then, of course, if this is significant, to do a real thorough cardiovascular repair program, which I can set you up with after your appointment if this is what I see in your blood. So here we have a field of red blood cells, a still picture of red cells, a white blood cell in the upper right, a bunch of little crystals scattered throughout here, and a large leaky gut toxin called a protoplast again. You can see this form this is something that is common that you may end up having in your blood. It's not unusual, but it shows that your intestines are letting waste into your blood, and that waste can accumulate and embed themselves in tissues and organs and cause achiness and pain and headaches and fatigue. All kinds of problems can be caused by this leaky gut condition. So if this is substantial in a person's blood sample, we have to really clean out their intestines, repair and heal the intestinal lining with good quality probiotics and other healing foods for the intestines. These bluish crystals in the background here are chemicals or heavy metals. So this person's blood, obviously they need some liver support to help filter the blood. Sometimes it's useful to do saunas, juicing, detoxification for the liver and gallbladder programs would help this blood picture, and healing the leaky gut. So that's what we'd see here. And the red cells look generally pretty good. So despite this huge array of waste in the blood, the person's red cells, the membranes are intact, they're smooth, so the person actually has reasonably good nutritional status, but this is a toxic bloodstream, basically. Here we have a blood picture where the cells are really heavily stacked together. And in the background, you can see this sort of spider web in the background. This is called fibrin, or activated fibrinogen. So this is a clotting factor that is activated when there's inflammation or damage to some tissues. This could be caused by a lot of things, including an injury, weakened, damaged blood vessels, or a very toxic liver will congest the liver so much that the liver can't filter out this fibrin from the blood. It's important to note that all these things I'm pointing out in the blood can be fixed. They can be improved and even reversed completely if we know what's going on and what to do. So the point of this is not to scare you, but just to show you the types of things you can see in the blood. This person has a lot of inflammation. Arthritic conditions will show up like this. People that have lots of pain in their body, people that are very toxic will often have this. The net result, though, is this person's oxygen levels in their blood is very low. They have very poor oxygen carrying capacity of the blood cells. This is like what I'd call a swampy bloodstream. We want to convert that to a river flowing bloodstream full of oxygen and nutrients. So what I would do with this person is a very intense period of cleansing, detoxification, enzymes. Enzymes taken on an empty stomach. Proteolytic enzymes will break up this inflammation, break up these cells being clumped together and get the blood flowing again, which is the first step towards vibrant health, which is to have good circulation, good oxygen supply to the organs and glands and tissues. So if your bloodstream looks like this is a sort of an extreme version. If it looks even, a percentage of this, 50% or 30% of this, that means there's definitely room for improvement. We can get the blood flowing better. And once we get on a good program, this blood picture will improve significantly. When you have these big black blots in the dry blood, there is a correlation to a person having parasites in their stool samples. So in this case, this particular patient or client had parasites for sure, and they showed up in the dry blood like this. So we would recommend is a parasite cleanse done for 30 to 60 days, and that will, in 9 times out of 10, clear it up. And parasites are going to be they're one of the categories of the underlying causes of health problems, which is chronic infections. It depletes your body of nutrients. The parasites put waste out into your bowels and reabsorbs into the bloodstream. So it's a form of toxicity, weakening of the immune system, nutrient deficiencies, and all the things we talk about that are impairing you to reach your optimal, vibrant health. So here in this dry blood picture, you can see on the edge there's a black ring, and the darkness and thickness of this ring correlates the amount of heavy metals that are in this person's system. Sometimes the black ring doesn't show up because the metals are deeply buried in fatty tissue or organs, but often it will show up in the dry blood like this. So this tells us either we should start on a heavy metal cleanse, or if we need to get some more verification of which heavy metal it is, mercury, arsenic, aluminum, cadmium, lead, or whatever, we could do another test to verify that and to get more of a quantified level of what's in the person's system. But this is basically a heavy metal ring appearing on the outside, the edge of the dry blood sample. Here we actually have a sample of live blood, not a still like the previous pictures. You can see the blood cells are moving, the red cells are moving nicely. In a few areas there's little points on the cells, that's undigested protein hanging onto the cell membrane, but overall the cells are moving nicely. Here's a white blood cell right here. They'll start to move after about 10 to 15 minutes of being outside the body. So when we first get the blood out of your finger, the white cells are a little shocked, not used to the new temperature on the slide, so they might not move for a little bit. But this is a sample of live blood. Here's 3 more white blood cells, nice size and shape. This is about the right, here's some more white blood cells. And this is basically what a good section of blood would look like. The cells are relatively separate from each other. They're not stuck together like in those rouleau patterns. The background is relatively clear of fibrin and waste chemicals and toxins and leaky gut waste. And the white blood cells are about 2 or 3 times the size of the red cells. You can see that. And that's about the right size for the white cells to be. So let's see if there's anything else worth noting here. No, basically this is what generally, minus the fact there's some undigested protein on a few cells, this is generally what the blood should look like. Now that you know what live blood cell analysis can show you about your health, some of the observations you may likely see in your own blood and recommendations that can correct that. I would like to let you know that this video is more than just preparing you to come and see me. It's something that I'd like you to be able to refer to in the future when you want to understand something again about your health. This is really an educational video that can be used as part of your library of nutritional and health and wellness education. So you can refer to these blood pictures, the underlying causation paradigm section I went over earlier with you, and it can be very useful for you and your family in the future. So I hope this has been very helpful to you. I look forward to seeing you at our appointment, and I'll see you soon. Finally, I'd like to invite all of you to sign up for my online newsletter by going to my website, www.createvibrant.health.com. There's back issues of my newsletter there. There's other articles I've written and video blogs I've put on there. And there's also my office phone number. You can reach me if you have questions at 541-482-2250. I hope this information has been helpful and inspiring to you to create vibrant health. Thank you.